Despite the significant decline of coronavirus cases in South Africa, health authorities are administering COVID-19 booster shots for the vulnerable groups amid concern that new variants are spreading in the country. Now, South Africa was the hardest hit nation by the pandemic in Africa, leaving officials vigilant about emerging new infections. The demand for COVID immunizations has, however, dropped, but authorities are not relenting on their course to protect the population. Let's have more details of that in this report.
South Africa's Health Ministry is planning to give all eligible adults COVID vaccine booster shots as it tries to curb the spread of the coronavirus. Although the country has made good progress in curbing the spread of the virus, there are concerns that new subvariants are circulating. Health officials are hoping that many people will take the booster shots of the COVID-19 vaccines available. According to public health experts, while the pandemic still poses a threat, it's currently at its weakest point.
The current phase for the pandemic in South Africa is very quiet. I would like to call it like that. There has even been a decrease of 18% of the number of new cases for the past recording week, measured against the week before that. We must remember that we are at the height of summer, which means that many people are much more outdoors and not in close contact with one another. So it is perhaps the low point of any pandemic at the moment for us.
After more than 2 years living under the threat of COVID-19, many South Africans are learning to live with the virus. The economy is on the road to recovery and fewer people are wearing face masks. But experts are warning that virus surveillance remains important.
I think surveillance is always great, right, for any infectious disease. We do it for flu, we should continue to do it for SARS-CoV-2, because one never knows. We know that it's an RNA virus which can mutate. And the worry always is that we end up with a variant that is, more virulent, has more impact on severity of disease or even death. And so you want to monitor that, right?
For now, public health facilities are gearing up to roll out COVID vaccine booster shots to anyone over 18, as health workers move to protect the population against the emerging subvariants of the virus. While plans are underway to provide booster shots to all adults, the number of vaccination sites have decreased due to a drop in demand. Public hospitals, though, will still be providing facilities to all those wanting to get vaccinated and protect themselves against the new subvariants that are emerging.